The WBFO Mental Health Initiative is funded by the Patrick P. Lee Foundation. Welcome to WBFO's Teaching Mental Health, a conversation about the new mental health curriculum in New York State schools. Join in on the discussion by leaving a comment on Facebook or by emailing us at fblive@wbfo.org. And now, please welcome your moderator, Eileen Buckley.
Hello, I'm Senior Reporter Eileen Buckley, and welcome to our WBFO Facebook Live conversation today. It is about teaching mental health, and we are continuing these public conversations as part of our mental health initiative here at WBFO, helping to break the stigma surrounding mental illness. Now, the school year is well underway across the state, and a new mental health curriculum is also being taught. It's mandatory that all schools across the state teach this mental health curriculum from kindergarten through 12th grade, and we're going to explore what the law requires for school districts and how the state education department is supporting schools with the new mental health teachings. Joining me today for our discussion is our New York State Education Regent Rep, Catherine Fisher-Collins. She is the Western New York Regent Rep. And we have Michael Cornell. He is the Superintendent of the Hamburg Central School Districts, and Mark Laurrie from the Niagara Falls City Schools. Thank you all for your busy schedules being here today, taking time out to talk about this important curriculum and the mental well-being of our students. We really appreciate your time today.
You're welcome. My pleasure.
Welcome. We, of course, want you to join our conversation on Facebook Live. Send us your questions, comments. We'll do our best to get them all in the time that we are given for this conversation today. I want to also start and begin actually with Catherine because this is something that's a state law, and the state education department, of course, is putting out support and offering back support behind this. You must be certainly pleased, you're a nurse practitioner by trade as well as an educator, that this state mandated law is finally in place. It's long overdue, as many have said.
It's long overdue, and I'm thrilled because back in the 80s, early 80s, we had a mental health program at one of our Buffalo schools, Build Academy. And at that time, we had a nurse and we had a psychiatrist. And so we were on the cutting edge of hopefully trying to get it in the program in other schools. And I know about the program because I funded the program through a program called Model Cities. So we had the money and we saw the need. But however, money drives programs. And when the money dried up, the program dried up. So I am just thrilled that State Ed decided that they were going to take this issue on. Before I became a member of the Board of Regents, they were working towards this. So now we have it in our curriculum. And we have people like our superintendent is here with us this morning that's working to help make sure that their staff is aware of how we introduce this serious problem, one that no one wants to talk about because of the stigma that is associated with mental illness. And we do know that mental illness, I know from the medical professions, that it's just like any other disease. It's like diabetes. There's treatment. You just have to get there early enough. And we're trying to get there early enough with our young children too.
And the statistics show that so many young people are suffering from mental health issues, and so that is the key.
One in five. We're talking about 50 million children in this country in public education, and 1 in 5 is suffering with some form of mental illness. That's a lot of kids. It's a lot of kids.
Gentlemen, I asked you both to be here because you made such a commitment through mental health work in your schools. Even before this curriculum was in place, I know I've done interviews separately with both of you over time. Michael Cornell at Hamburg, you talked to me about how you've pretty much identified that there was a problem going on a few years back and this need for mental health for your students. And now you've conducted mental health training for your entire staff, including bus drivers.
Yeah, we are seeing what everyone else was seeing. The frequency of students coming to us and presenting with mental health challenges. They're coming to us younger. The problems are more serious than they've been. And we had the awareness that the problem was complex. The problem, it was something we could do more than what we were doing with our counselors and social workers and psychologists. And a couple of years ago, we applied for a grant from the Peter Tower Foundation to administer mental health first aid training to our entire staff. So we got a $75,000 grant from the Tower Foundation, Money Drives program, as the Regent said, and she's 100% right. So we needed to fund the effort. We've also put some district funds into it because $75,000 didn't cover it entirely. And we did train all of our 650 employees between, it took us about 14 months to do it. Our target date was September 1st of this year to have it all done, and we met the target. And on top of the 650 of our district employees, we also trained all of our bus drivers who are not district employees. Fisher Bus Service has been our bus company for a very long time. They've been a great partner for us for a long time, and they worked with us to make sure that their employees were available for the training as well. So, I don't know, maybe 750 or 800 people we trained in 14 months, and it's a full day training. So, I did it, everybody did it, and it's one of the best professional learning opportunities I've ever had.
And Mark, your district was recognized as well by the state office, the State Mental Health Association, actually, for the work that you've done as well.
Yeah, and just like Superintendent Cornell, we've made it our #1 initiative this year to not only train everyone in mental health first aid, but to even take it a step more and begin to train some of the students at the high school. Because peers watching peers with proper training and identification can be the best sort of information. So we've engaged in a program called Sources of Strength. It's a rigorous, intense program like mental health first aid, but it trains our students who are with their friends. And if they're not there to fix anyone or to point the finger at anyone, but just to say, listen, I know what you might be going through. Why don't you speak to this person or that person? So our goal is to take it further and go right to the students who hear and listen and spend time with each other. And like the Hamburg School District, we were able to get a support from the Population Health Collaborative of Western New York that funded our mental health first aid training. It's a perfect example of collaborations working with school districts to provide the needed money. And I applaud the State Education Department, our Regent, for recognizing this. They've been able to take the stigma away by saying that this is important. Now it's our job to implement everything that they've asked to do. And it's not just, it's the role of everybody. And that's why I applaud Hamburg too, because they've recognized that the bus drivers are the first people kids see in the morning, and that's where you may pick up a sign or a symptom. So it's a community issue, not just a school issue. It's a community issue that everybody has to get behind, and it's not a curriculum where you do it on Tuesday and it's done on Thursday. Right. This has got to be a language and a culture that permeates throughout the school year.
And that's what I was going to ask you. It's not that you put down this curriculum and said every school has to do the same thing, correct? They all came up with their curriculums to customize their schools.
Right, they customize it, they tailor it to their school district. And one thing that we have to keep in mind that these children are living in households where there are parents who may be having some mental health issues as well. And so we have to reach out to them, and I'm hoping that some of our districts across the state will have parent programs where they would bring them in to talk about mental illness with the district and what we're doing, so they'll know what we're telling the children when they come home as well. And so we have to keep the parents in this loop as well, because it's important. It's extremely important.
All in recognizing what's happening with the students' mental health.
And I don't mean to be overly dramatic in this statement, but I really believe if you look at where public education is going in the future, I think we're going to see our schools more as centers of mental and physical health, as much as they are of bastions of content for curriculum. Kids can learn a lot on their phone and on their computer. What they can't learn is healthy relationships, healthy being, and if we're going to exist with technological advances, the one thing that will never go away is how we take care of and treat each other, and that's where I think schools are going to morph into.
To your point, we went through a whole thing last year. We redid our mission statement and core values and created a vision statement because we didn't have one. And our vision statement is creating modern thinkers who create, care, solve, and discover. Because we have to be a part of that mosaic of effort that helps our kids care about each other, care about themselves, care about the community, care about the environment, care about, because if we don't care for each other, we stop being a community. And that's an important part of all of that. And to the Regent's point, the nenext phase of our mental health first aid training is to do it for parents.
Yes.
Is to bring them
Wonderful.
in, and we have just these fantastic trainers. They're our teachers and administrators who are ours, who we sent for a 5-day training. They're fantastic, caring people, and they'll be the ones who deliver that opportunity for parents in our community. We'll start that hopefully at some point this school year. I'm not sure when we have it set to go, but inviting families in for either the conversation or for the help through our family support center or parent-child connection. Again, it's a mosaic of efforts that every school district undertakes to try to help our kids be well and safe in school.
And we have to let our community know that when our children are identified having a mental health issue, that when they graduate, we don't just push them out the door. That through our access office with state ed, we plan for their community location where they're going to be and their medical. We follow up with them. We don't just say that kids, you've had this problem, okay, goodbye when you graduate. Our access program is state ed, and we have them all over the state. We make sure it's like when you're in the hospital and you have discharge planning. So we do something similar to that for mental health discharge planning for our students. So we don't just drop them when they finish. And we hope that, parents will learn about that, work along with our mental health counselors in our schools, because we got to destigmatize mental illness. As I said earlier, it's just like diabetes. It's treatable. Don't be afraid of it. Some pills work and some pills will cure you, but sometimes you have to continue to take them. So we have to encourage the parents to work with the kids to make sure they take their meds. My concern, the only concern I have right now, is that we diagnose them appropriately, that we put them into the classification. Some kids have behavioral issues, and they're not mental health issues. It's not a mental health problem. It's more of a behavioral problem. And so we have to make sure that we get them into the right category so we can serve them well. We have to be so proud in this state, and I'm so proud of the fact that we have a program like this. That's the first in the nation. New York State has always been that way, though. We have been, the first to take on the MBK program, My Brother's Keepers program, the first in the nation. I mean, to say this is a project and we fund it. I want to see more funding go into the mental health programs that we have in our schools. So superintendents will have monies to bring their parents in, give them some coffee, sit them down, talk to them, spend a little time with them, not rush them in or rush them out because we just don't have the resources.
We welcome that. So
I
thank you
know
very
you
much.
do. I know you do.
I wanted to talk about how you crafted the curriculums a little bit, because there are some questions. We had one person send us a note from the Guilderland School District, which is outside of Albany.
So my sister lives there with
Oh,
her
fantastic.
children.
Asking, when is this being taught? It's being taught through health classes, from what I understood, and possibly physical ed classes, because there's a difference from the middle and high schools.
It talks about, there's the physical, the mental, the emotional well-being. So there's the triangle. And it's funny, I was out in classrooms this morning. I walked into one of my 7th grade health classes, and there was the teacher, gave the kids a survey of 30 or so prompts, and they had to put a rating on it. And then they scored it, and then they drew the triangle out. And I didn't see the whole rest of it, but really the essence of the lesson was to help them understand the connection between their physical, emotional, and mental well-being, which is actually written into the law that created the curriculum itself. So a lot of our work around it, whether it's a health class, a physical education class, we have a health teacher. We're fortunate that we have a health teacher in pre-K through 5, which is just dedicated to the elementary schools. We have a partnership with Western New York United, who's been a great partner for us, who works with our this K through 6 on healthy choices, again, mental, physical, emotional well-being. So it's articulated that way, and then in health and physical education beyond that. And then we also have our psychologists, social workers, and school counselors who push into all classes, pre-K through 12. Right. So it happens in a variety of ways, and Superintendent Laurrie is so right. It's not just a curriculum. We're going to do this on Tuesday and this on Thursday. it takes a lot of forms and serves a lot of functions so that our students are safe and well at school every day.
So it's woven in.
Yeah, every day has to be a day to teach mental health. It's not an event. It's an ongoing language and culture that has to be part of every teacher's classroom every day, because it shows itself and manifests itself in different students at different times, and you have to stop for those teachable moments for the student who may be in crisis and the others around him or her that might be in crisis. So if you're thinking about it as an event, and I've been asked this question on a number of occasions, when can I come and see? You can't come and see it on a specific day. You've got to live the culture of it. Yeah. You've got to be part of it. We've got to use the language. Yeah. We've got to use our listening skills, our body language, our resource development. We have initiated for the last 3 years now 3-year-olds in Niagara Falls. So by the end of this school year, 120 3-year-old children will be in school in Niagara Falls. It's one of our ways to try to address it early, with the belief that a better beginning will make a stronger completion. So you take kids at 3 years old, and what can you do with mental? Well, there's play therapy, and there's conversations, and there's rituals and routines, and there's centers that build themselves around good interactions that are part of mental health. And then you take it all the way to the high school level, where I'm really pleased to say that in October we're going to be bringing in Kevin Hines. He's a speaker. He delves into suicide at great length. We're going to be bringing him in for the students at Niagara Falls High School during the day, and in the evening he's going to present to the parents in the community, screen his movie, and show his story about how he overcame his suicidal urges and tendencies to become a productive, healthy citizen in the state. And he's one of the foremost authorities on that.
Is he the one from California?
He may be, yeah. He may be, but he's a pretty big time speaker.
Yeah, yeah.
We're also going to do a community read, where we select a book, and everybody in the school, or hopefully in the community, reads a book about overcoming addiction and some mental stress, so that we help to destigmatize the words mental health or need for help. We all need help. Yeah. So that's a big part of it.
And both of our superintendents have done what we were hoping. We gave you the guidelines out there for you to work with them, but you're teaching mental health across the curriculum, and that's the way it should be done. At the college level, we were teaching reading across and writing across the curriculum, but we're just taking what we've given you in terms of guidelines, and it's everywhere. Right. Like you said, you can't just come in the classroom and see it unless there's a speaker like what you're bringing in.
You made me think that in the middle school, we're doing it through food. So we're going to have Chef Bobby, who was on the Iron Chef. Yep. He's connected with our My Brother's Keeper grant, but where he's going to teach a first period class to 15 7th graders and 15 8th graders. Yeah, he's going to teach them how to cook, but there's going to be a lot of dialogue going on. And while they're cooking and learning how to use some culinary skills, they're also going to be talking. And that's really what the intervention is.
And it gives a fun way for them too.
And while you're mentioning that, we have planned in your community in Niagara Falls on November 3rd a mental health forum.
Great.
And so we want to bring the community in, and of course we're going to bring the high school in and bring individuals in to talk about it again from every standpoint that we can. And it's going to be there in the public housing project as well.
Great. Well, interestingly, again, we have a minority population that's 60% in Niagara Falls, and we speak to our minority population about mental health because it's not something that's talked about in the minority community as much as it might be in the white community. So we're in tune to that. We're addressing that. We have to look at everybody, and we're not afraid to say those words and to act that way.
And this brings me to, I had a chance to speak with the State Education Commissioner, Mary Ellen Elia, a couple of weeks ago about this, and she said that we need to understand that kids are coming to school with a lot of baggage, and many are under constant trauma. So I know that your districts are experiencing that. I know that on state ed level that they've examined that. What are you seeing right now with that issue? Because I know they've done so much with trauma-informed care in the schools.
And if you think about students who come to us from impoverished households, they experience, according to the research, trauma that is similar to that of PTSD. And you talk about emotional well-being and emotional responses. There are 18 possible emotional responses to stimuli, and 6 of them are hardwired. The other 12 have to be taught. In an impoverished household, they often aren't taught. So they come to us in school not equipped to have an appropriate emotional response. So we have to teach that emotional awareness and well-being so that we can have, a conversation and dialogue and interaction in a school setting, and they can enjoy it and feel a part of it and feel a sense of belonging when they're in the school setting. So with respect to her comment about trauma, just poverty in and of itself is trauma. And, in our school we have 18 to 20%. In Niagara Falls it's much higher. But we know, I think not only do 1 in 5 kids in schools nationally have a mental illness, 1 in 5, or maybe I think it's 1 in 2, is it like 48 or 50% of our students nationally come from an impoverished household. So that whole trauma-informed piece, it starts with poverty and goes from there, and that's 50% of our kids.
In terms of the minority community, in terms of not dealing with mental illness, people of brown and black, they have so many issues that they have to deal with. This is just adding another thing for someone to push them back. Okay, so they have the fact that they're coming in from communities that are falling apart, housing is poor, medical treatment is poor. So therefore, if you bring this forward, that gives someone else to poke at them a little bit more. So we're not trying to poke at them. We're trying to make sure that they understand that this illness is everyone's illness, not just in the minority community, but the minority communities have so much trauma with the shootings and the lead poisoning and there's so many things that they have to deal with. This is just another thing to deal with. And if we can make it and put it in such a package that is packaged with other things, like what you're doing is teaching mental illness across the curriculum. The coaches, the nurse, the classroom teachers, the social workers, everyone is working on this one issue for us. And that one issue just fans itself across so many pieces of education.
Yeah, even things like our culture of kindness,
Yeah.
which is something that's related to DASA. Everything's related to an acronym one way or the other. But, so we've been doing that for 7 or 8 years, and it's grown to the point where we have 30 high school kids who come and teach our culture of kindness every year to all of our elementary school kids. And that's your emotional and your mental well-being, so people have that sense of belonging. And we're so connected as a society, with devices, yet people feel like they're on an island to themselves and don't feel like they belong. So making sure that we're welcoming in a school setting is a part of addressing that emotional and mental well-being also.
I think you have to be intentional too with everything you do, and I'm thinking as we're talking, some things that may not have started out for this reason. I'm talking about something we're doing with flexible seating, and something that the Regent said. She said, we want to move this so when you're a graduate, you graduate to society with strong roots.
Yes.
And you think about, I think about the way our cafeterias were set up, or our desks were set up in rows, or long tables. That's not how the world eats, and that's not how the world communicates anymore. So when I think about the number of classrooms in our elementaries, primarily that we're doing flexible seating with, where there's different ways you're reading and writing with your partner and in the classroom community, that's a real non-direct way to address mental health, but it's a direct way because you're building a ritual and routine. So the point I'm trying to make is that everything has to be intentional and thought through and purposeful, and it's not just a script that State Ed gave us or that we're all going to follow. What works in our community at this time for the kids in terms of where they're at.
You're so right. I was in a 5th grade classroom this morning. I got out a little bit today. It was a good day. I got out. So I was out in a 5th grade classroom, new teacher to us. And I'd been told, you got to go see Miss So-and-so's classroom. It's fantastic. So I go there, and they're right. It's fantastic. She has all these different seating options, different tables, different chairs, exercise balls, pillows. I mean, it's all there, right? So then she goes on to tell me that she had them give a reaction to how they felt in those seats each day. And then they'll make a permanent choice about where they want to sit in a few days. And I said to her, well, help me understand why you thought that was a good idea. She says, when these kids go to middle school and high school and graduate, they're going to have to be aware enough of their surroundings and themselves and how they learn and how they interact best. And they're going to have to make choices for themselves if they're going to be well in their lives. Right? And I thought the exercise ball was a cool place to sit. She's thinking they need to be able to be well enough and self-aware enough, emotional well-being, to be able to make good choices for themselves rather than have those things dictated to them at a young age, and build that capacity as a part of their emotional well-being. And I thought, to your point about being intentional, she's a new teacher. Yeah. She's like, some of these young people we have coming into education today are light years beyond certainly where I was when I was coming out and going into the field. So thank goodness for great teachers in all of our school districts, and administrators and engaged parents and board members who support all these things, because but for that, we're really in a bad way. So I just want to bring that out too.
I do want to get to some questions from our Facebook audience that have been kind enough to write in. Courtney is asking, this is an important question for substitute teaching, will there be training for them as well?
That's a great question, and I wish I could tell you for sure. Okay. I'm sure we intend to. We do have our substitute teachers do lots of other training. I would hope that we would get to that at some point. On the mental health first aid training piece, for sure, I think we'd like to do that. In terms of them being able to deliver the mental health curriculum as we delivered in the district, so that we were compliant with the state education department regulation, they'll have all the capacity they need to do that for sure.
We've talked about it at the Regent's meeting through my higher ed committee, that for substitute teaching, we have to make sure, teachers, we have to make sure that they're trained too. Right. So we're looking closely at how we train our substitutes. Some of our substitute teachers are there for 5, 6, not just days, months, years. They come back. So they're there. They're almost permanent in some places.
Yeah. Well, our substitute teachers are our next teachers. That's their interview in Niagara Falls. So if you're substituting in Niagara Falls, you're going to be part of it because that's your interview. The other thing that I would like to see, and we see it with child abuse and neglect reporting, which is a mandatory class. I don't think anybody should come out of a teacher preparation course at any of our colleges without mental health first aid training. That needs to be a certificate that gets checked on the box of the teach system that says at least they've had the mental health first aid training. And I'm not trying to put more mandates on colleges or the state, but I don't think I could hire somebody as a teacher who doesn't have a working knowledge of how to at least know the basics of mental health first aid. So I'm putting that back on the individual. That if you want to come and work for us, I think you should go and get that training on your own.
Yeah, and this is also evolving too. We've gone from, I think really not talking about it at all 18 months ago to a curriculum and all these other things. So I think we're, schools have always been in a position to have to adapt. We're adapting to a modern world. We're adapting to a world where 50% of the jobs who are out there, they're going to be out there 20 years from now, haven't been invented yet. For people who are going to go into jobs like being an electrician, which has been around for 150 years, those jobs are going to be done totally differently. And then add to it we are the place where the symptoms of society's ills manifest. So, we've gone from 0 to 100 pretty quickly, and we're just trying to catch up to all these other pockets of people who we want to help them, because people want to be aware, they want to be helpful, they want to be knowledgeable, they want to do right by children and be a good colleague. So when they ask that, we know exactly why they're asking, because they want to be effective and helpful, and we want to help them too, and we'll just have to grow in our capacity in some of those areas for some of those pockets of people.
There must have been too concern of overburdening teachers with this, because I know that they have felt so much burden with assessments and other things that are required of them. You gave us a great example of a teacher that has embraced this, but how do you not overburden the teacher in this?
Yeah, I think the only way to create more time in a teacher's day is to abandon something. There's no other way to extend the hours or extend the day. We've got to look at every practice and say what is important and what is not getting us to our mission. And as I said before, I think the need to have this mental health training and mental health language and culture built in supersedes so many things. And I applaud state ed. I applaud our commissioner and our regents for taking a look at those It's the best I've seen in a long time in terms of those requirements that you were speaking of that have burdened teachers for a long time. I know our commissioner gets it. I know our Board of Regents gets it. I know that they know it's about educating the whole child and what's important to their future. And we're starting to see, I think, a positive shift in what's coming down to us. So as they take a look at that with kids in mind, those kind of issues are lessening, even though they're still there. I don't want to, we're still there to create future citizens who are academically adept and ready to go to the next level. But I applaud the commissioner and the Board of Regents for looking at the whole child.
Well, it's not just the burden on one teacher. It's across the whole curriculum. And that's what they've been doing, is teaching everyone to be a part of this mental health identification issue. So therefore, it's not burdensome on just one classroom teacher. Everyone takes a part of it. And I think that's why we gave the guidelines and we said, okay, superintendents, go with it.
Right.
Boards of education, go with it and put it in place, and gave you the leeway to design what you need. You're in the communities, you know.
That's right.
And,
That's how it
to, our,
should be done.
and to our teachers, I mean, public educators in our state are wonderful people who love and care for children. And I haven't been around a single teacher. We've talked to a lot of teachers and all of our adults about the mental health first aid piece of it. And despite the fact that it was a full day out of the classroom, I don't feel like any of them would identify it as a burden. I think that they really did appreciate the opportunity to have the heightened awareness and have a capacity. And we don't want our social studies teachers, and I'll pick on them because I'm the social studies teacher. We don't want a social studies teacher to go treat a child for mental illness.
No.
Recognize the signs, ask some questions, be informed about what you're asking, and be able to say to, Eileen, you're a school counselor, this is what I'm seeing, and use some precise language so that you know exactly what you need to ask Johnny about, because sometimes time is of the essence. So teachers want that, and their parents themselves. So they view this opportunity to learn and build capacity, not only from their professional perspective, but from their perspective as a mother or father, grandmother, grandfather, or in whichever way they are a caregiver to a child. So, whereas, truth be told, many people have felt like they're drinking from a fire hose with one state initiative after another since 2010 or 11. This has been one where I think our professional educators have said, I get it, this makes sense, and I'm happy to have at it and go learn.
And you have to understand that these teachers are coming from households where there may be individuals in their families, in the community that they live, that they operate and work with, that may have these issues. And that way it makes them a better caregiver because they're knowledgeable and you've helped them learn this information.
Another question that came in from Donna, and this is a great question about how it's going to be monitored and checked. How will New York State be measuring it to make sure individual districts are following the law indeed? And perhaps you can explain what they've told you and what the state is.
Well, monitoring is important. It's like we're going to be monitoring a lot that's happening through our ESSA plans. And as the districts submit their plans, I'm pretty sure that they will incorporate some portion of mental health, the programming that they have in their schools, and we'll measure it through the ESSA plan. I think it's really, it's not going to be hard to do. We're going to be able to, and I'm pretty sure that that you'll be meeting with other people out there and talking about it, and just this program alone is telling the community what we're going to be doing, and we're going to be monitoring you because you're giving us the information up front.
But I think it's also important to recognize that when you're in a social service industry like we are, some of the most meaningful effects can't be counted. We're not going to, there's not a lot, there aren't a ton of numbers that we're going to be able to attach to the effect that what we are going to do is going to have on the lives of children and families. So sometimes I think we fool ourselves into thinking that we can count everything, and I think we have to be realistic about the fact that you can't count everything that counts. So I think that's something that we think a lot about in Hamburg.
Yeah, some things aren't quantifiable, but you'll see it in all of our school improvement plans.
Yep.
And then what we have, we've engaged with an outside firm to do a yearly assessment using the Youth Risk Behavior Survey. That'll give some indicators, self-reporting by students. That'll give some indicators. We have some baseline data from 2015. We've implemented some other programs about healthy behaviors and healthy relationships. We'll use an outside firm because we didn't want Niagara Falls to say, yeah, sure, I'll evaluate and say I'm doing great.
Yeah.
We wanted someone kind of with cold eyes to come and take a look and to show the community they're doing well here, they're doing well here, they're not doing well here. And when we did that in 2015, well before the initiative, we saw the number of students who had suicidal ideation and suicide attempts at an alarming rate. And that spurred us to move quickly. That really put a lot of fire in ourselves to get moving on that because of that statistic alone.
Yeah, we've done the same study, and Western New York United actually as an outside agency we contract with. In fact, we have somebody coming in I think next week to go over the data with us so that we understand. We have the general assessment like what Superintendent Laurrie talked about, but then we also do pre-assessment and post-assessment in our K through 6 population who has the opportunity to be with the educator that we get from Western New York United too. So we do have some of that empirical data as well.
And our school climate survey is going to go out to the entire state. We had a small study, and now we're ready to find out actually how everyone feels about the climate that they're working in. So we'll get data that way as well. Okay.
The suicide topic is so difficult, but I know that the first aid mental health training talks about that. And you had talked to me a little bit in an interview I did in the past about actually sitting down with a child and using that word and not being afraid to use it.
Yeah, there's two things. So as a part of the mental health first aid training, we're actually trained we have to actually ask, like if Mark and I are in the training together, I'll have to look at Mark and say, Mark, are you thinking of killing yourself? And that's an uncomfortable thing to say even in a training setting, so that, and nobody wants to ask that of a child, but the research tells us that if you ask, you're not going to cause that young person to think more about it because they're already thinking about it. What is important though is that maybe we find out if they in fact are. So that's a part of the training. Then our next iteration from mental health first aid training is every one of our employees is going to get a training in suicide this year. It's a 2-hour training. So that's going to be built into our professional learning plan for the entire school district for this year for exactly that reason. It's the next thing that we need to be concerned about. And as Mark said, the incidences of students who have suicidal ideations, and unfortunately, as we're finding, children who will act on those is increasing at an alarming rate. And we want to be able to be aware of what some of those warning signs are and how to perhaps identify them in a more meaningful, immediate, and precise way and refer them to somebody who can help right away.
And on a much larger look at this, will this indeed help prevent a possible violent incident in a school? I hate to say it, but a possible shooting. Will this help in alleviating that problem that we're seeing nationwide?
If we start early on, I think identifying children and get them into the right categories of care and treatment. When you mentioned suicide, I was reading for the educational testing system, AP Biology. Now I was out in the Midwest reading these exams, and at first page I opened up and there was a stick drawing with a noose around the person's name. Now this is a person who's taking the biology exam. So even in the art teachers who look at what these children are drawing can pick up on some of these, or guns that kids are drawing in exams. Now with that particular, because I'm in the Midwest and I'm looking at this stick figure with the noose around its neck, and what do? I go and tell someone they have to call the district, find out where this kid is, because they're contemplating suicide. So there's many cues out there. And even in the art class, like I said, even in art and music, you can pick up signs of where these kids may be getting ready to do something that's not really. And I was just touched by it recently with someone that I know that left here with suicide. So it comes at you from all different vantages. We just have to be smart enough to recognize it.
Yes.
Yeah, I guess anything is ever possible anywhere, God forbid. But we have to be intentional, we have to be observant,
Yes.
and we have to put as much effort as we can into both. I guess we would be talking about the soft skills today, as well as the hard skills, the hardening
Hard.
of our schools that we've talked a lot about previously.
Yeah.
So I think it's a combination of both, but a right balance there. And then it's just to be mindful of everything that's going on.
We sometimes get fooled into thinking that one solution will fix one problem.
Yeah.
And, education has been guilty of that for a long time. And, one of the things that I appreciate about what a lot of our school districts are doing, everybody's doing something to address mental illness. Everybody is. We all care. Everybody's doing something. And the important thing, I think, in the lesson for us is we've decided we have to figure out what that next thing is and what's the next thing. And eventually you build a mosaic of efforts: parent-child connection, family support center, mental health first aid, a school resource officer, culture of kindness, hardening your building. And it really is all about helping kids feel safe and well, challenged and supported while they're at school. And, it's a mosaic of efforts, undertaken by a large group of caring people who will ultimately help kids be safe and well at school.
And Dr. Collins talked about the parents' involvement, and it's a call to the parents to say, if you see that diagram at home,
Yes.
if you see this artwork or this song continually playing, you've got to let us know too. It's got to
right.
work both ways. The door's got to
right.
swing open both ways.
That's right.
Because we're with children 6-7 hours a day, and that's why even adding summer programming and more sports are more opportunities. See, to me, those are mental health programs. The more sports you have, now you have a coach looking at a kid. Now you have an assistant coach who's helping it. That's all part of the mosaic that we're talking about. But it also works the other way. A parent who noticed something, a guardian, a grandparent, has got to speak up and talk to the school, talk to the appropriate people.
Yes.
One more question that came in and we'll wrap things up. Chandra asks, and this is another important issue, how does this change a school counselor's role in responding to the mental health needs now that you have other folks involved in that mental well-being of the child?
What we hope happens is there's a greater referral rate
Yes.
to our school counselors and our psychologists and social workers. And one of the things that we've done over the last couple of years as we've incorporated mental health first aid training into our mosaic is we also added social worker help and added 2 school counselors. So, I think the role has been changing for some time. It's out to any school counselor, they're going to tell you that it's been changing for 10 years. So this just gives them maybe a more sophisticated referral mechanism as long as we provide them with the manpower to deal with it, I think.
Yeah, we're adding social workers in Niagara Falls, primarily at the early grades, and we've added a school psychologist. But I think it puts the burden on all of us to become more of a counselor. And if we think that just the counselor alone is going to solve this, it's impossible to have enough counselors to work with as many kids as 1 in 5, whatever the ratio is. So everybody's got to have a little bit of counselor in them. And then the school counselor and the school psychologist has a very changing role that gets more in depth and more intensive.
And everyone has to work together in the school setting. Because through the Say Yes program, we've put counselors in our schools as well. So everyone has to talk about a child that may have difficulties. Everyone who's touching that child. And I think collectively they have to get together and decide on a care plan for that child.
And the Buffalo schools, I believe, have over 50 mental health clinics on site, so it's wonderful. I want to wrap things up and thank you all for taking time out of your schedules to talk about this important topic. We wish you well in your curriculums. It sounds like you're off to a terrific start. Regent Collins, thank you so much for being here and representing the state ed.
Yes.
And gentlemen, Michael Cornell from the Hamburg Central School District, thank you so much.
You're welcome.
Mark Laurrie, Niagara Falls City School District Superintendent, thank you both for being here. And thank you for the Facebook Live audience for joining in. We really appreciate it. We want to keep the conversation going. You can continue to send your comments in on Facebook. Thank you so much.
The WBFO Mental Health Initiative is funded by the Patrick P. Lee Foundation. Thank you for joining us for Teaching Mental Health, a conversation about the new mental health curriculum in New York State schools. For more information, visit WBFO.org.